Today, I'm going to show you 6 science-backed tricks to maximize your size and prevent shrinkage, strategies that go beyond just pills or gimmicks. Before we dive in, if you're ready to take control of your sexual health, like this video, comment below where you're watching from, and subscribe so you don't miss my weekly tips for men over 40. Now, let's bust a myth right off the bat. Shrinkage is just part of getting older. That's simply not true. Aging can influence penile tissue, but it doesn't mean you're powerless. What actually happens is something doctors call penile atrophy. The tissue loses elasticity, firmness, and volume over time. This isn't about vanity, it's about function, comfort, and confidence. Tissue atrophy can affect erections, pleasure, and even your sense of masculinity. But with early intervention, you can prevent most of these changes. I see this in my clinic every week. Men come in worried that they're losing size or noticing changes in erections. And here's what I always tell them: it's not too late to act. The body is remarkably resilient if you address the underlying causes. From vascular health to hormonal balance, from sleep to exercise, there are practical everyday steps that make a huge difference. Let's break down the key biological, emotional, and practical factors so you understand exactly what's happening and why these 6 strategies actually work. Habit number 1, ignoring blood flow. Your penis, like every organ, depends on a steady supply of blood to stay healthy. Reduced circulation means less oxygen, fewer nutrients, and over time, tissue shrinkage. Biologically, aging blood vessels can't expand as efficiently, and endothelial dysfunction, damage to the inner lining of your arteries, reduces blood flow. Emotionally, this can make you feel frustrated or even anxious about performance. Practically, you may notice less firmness or smaller size. So, what's the easiest way to boost blood flow naturally? Stick around. Your diet plays a huge role. Habit number 2, skipping nocturnal maintenance. When you were younger, your body gave you 5 to 8 nocturnal erections every night. Think of them as natural exercise for your penis. They bring oxygen, nutrients, and help tissue maintain shape. Biologically, less frequent nocturnal erections mean less natural tissue workout. Emotionally, reduced size or firmness can affect your confidence in intimacy. Practically, less spontaneous rigidity, more struggle when you need it. Hint: sleep quality is huge here. More on that later. Habit number 3, reduced sexual activity. Every erection is like a mini workout. Men who are sexually inactive tend to see faster declines in penile health. Biologically, less blood flow equals less tissue maintenance. Emotionally, it can impact self-esteem, intimacy, and your relationships. Practically, you may feel less ready for intimacy or notice longer recovery times. If you think I'm too busy or it's too late, don't worry. There's a simple solution you can do at home. Habit number 4, low testosterone. After 30, testosterone naturally drops 1 to 2% per year. Low T contributes to tissue shrinkage, fatigue, and reduced libido. Biologically, testosterone supports tissue elasticity, blood flow, and erectile function. Emotionally, low T can leave you feeling less masculine, tired, or anxious. Practically, difficulty maintaining erections, less motivation, and muscle loss. But you don't have to accept low energy or shrinking size. Treatment options exist, safely and effectively. Habit number 5, insulin resistance and abdominal fat. A larger waistline isn't just aesthetic. It's a vascular and hormonal problem. Insulin resistance inflames blood vessels and hinders testosterone use, directly affecting penile tissue. Biologically, inflammation and metabolic changes reduce blood flow. Emotionally, it can lead to frustration with both body image and sexual function. Practically, men often notice both reduced girth and length over time. Reducing abdominal fat has more benefits than you might imagine. We'll talk about that in strategy number 5. Habit number 6, poor lifestyle choices. Highly processed foods, sedentary lifestyle, and inadequate sleep accelerate shrinkage. Biologically, chronic inflammation, poor blood flow, and low testosterone. Emotionally, feeling sluggish, less confident, and frustrated in intimacy. Practically, smaller, weaker erections, lower stamina, and decreased enjoyment. Now that we know the key habits driving shrinkage, here's the evidence-based action plan that can reverse or at least halt these changes. Trick number 1, boost nitric oxide and vascular health. What to do? Eat nitrate-rich foods like leafy greens, beets, and pomegranate. Why it works? Nitric oxide relaxes blood vessels, improves circulation, and enhances erections. Tip: aim for at least 2 servings of leafy greens daily. Trick number 2, optimize sleep. What to do? Prioritize 7 to 8 hours of quality sleep. Why it works? Deep sleep triggers nocturnal erections and testosterone production. Tip: keep a consistent schedule and reduce screens before bed. Trick number 3, exercise regularly. What to do? Mix cardio with resistance training 4 to 5 times per week. Why it works? Improves blood flow, insulin sensitivity, testosterone, and overall energy. Tip: even brisk walks or 20 minutes of bodyweight exercises help maintain penile tissue. Trick number 4, maintain sexual activity. What to do? Partnered sex or solo stimulation 2 to 3 times per week. Why it works? Each erection boosts oxygenation and keeps tissue elastic. Tip: frequency matters more than intensity. Consistency is key. Trick number 5, manage testosterone and hormones. What to do? If you experience low libido, fatigue, or shrinking size, get tested. Why it works? Testosterone supports tissue health and sexual function. Tip: only pursue replacement therapy under qualified medical supervision. Trick number 6, consider medical tools, vacuum devices, and supplements. Safely promote blood flow and stretch tissue. Excellent after prostate surgery, but only under supervision. Supplements L-arginine, pomegranate extract, and pine bark extract may support vascular health. Tip: supplements complement, not replace lifestyle strategies. Now, I want to be clear, results vary and progress takes time. Some men notice firmness and size improvements, others maintain what they have, and both outcomes are victories. What matters most is taking control early, consistently, and with realistic expectations. Your sexual health isn't vanity. It's part of your dignity, relationships, and quality of life. Every small step counts. Better diet, more activity, improved sleep, or simply getting tested for low testosterone can restore confidence. Here's the truth. Age is not the end of vitality. Men in their 60s, 70s, and even 80s are enjoying satisfying sexual lives because they took action. Start today. Implement 1 or 2 of these strategies now and build on them week by week. It's not about overnight miracles. It's about freedom, confidence, and living fully in your own skin. If you found this video helpful, hit like, comment below where you're watching from, and subscribe for more tips.